Radiance Medical, world leader in equine laser therapy with the exclusive super pulsed laser and patented complete spectral irradiance. We've introduced the MR4 ACTIVet cordless 25-watt laser for wounds, but also trigger point activation for acupuncture. Here we worked with Dr. Chad Davis.
Hi, my name is Dr. Chad Davis. I'm the Senior Equine Associate at Clarke Equine in Berryville, Virginia. I'm here to talk to you today about the multi-radiance laser therapy system, the MR4 ACTIVet. We'll be demonstrating on River here, who's a 12-year-old thoroughbred eventing horse, about using the laser in place of using acupuncture needles for trigger point therapy. So this is River. He's a 12-year-old thoroughbred gelding that is performing in eventing. He's your classic off-the-track thoroughbred, and mid-season has gotten quite sore in his thoracolumbar musculature. This horse in the past has had his sacroiliac region injected, as well as having some mesotherapy in his back. But once in a while, about this time mid-season, he gets some trigger points that get pretty active from his work. And so you can see on a classic palpation, almost any horse, you can get them to respond to their trigger points, but some of them get much more hyperactive to it. And so classically we just use some fingers to palpate those areas, and you can see the reaction that we get from River over these classic trigger points that we have in horses. And we can use dry needle therapy, but for River, who doesn't like needles, and rather than having to sedate him and then use acupuncture, it's best for us to use something like the MR4 ACTIVet laser with the trigger point tips applied to the laser to allow us to focus in on certain areas, just like we have here, to help alleviate this pain. In about 5 to 10 minutes, depending upon how active the trigger point may be, you'll get resolution of this reaction in the horse that seems to hang around for a number of weeks. So this is our MR4 ACTIVet from Multi-Radiance Laser Technologies, and this is our acupuncture, if you will, or trigger point therapy needle attachment for the laser. It actually is a glass tip that has no needle end, but it's quite sharp on the end, and we apply it by just screwing it into the face of the MR4 ACTIVet and using the same therapies you would on other parts of the body, and some that are a little bit more specific that we've set up with the calibration of the machine, specific just for the trigger points to get certain depths depending upon what trigger point we're discussing. So we'll get the laser activated, and once we've gone through the process of selecting the appropriate therapy system for River, we'll go ahead and begin the countdown here and begin the therapy to his trigger point. And truly it is as simple as what you see now. When you first apply it, there's no doubt the horse shows a little bit of discomfort as he reacts to the pressure of actually having the glass bead on that spot. But you see that they slowly start to relax to the pressure, kind of like a fulcrum you would normally have during a massage therapy session. So we just leave this on here. For him, it seems to work out quite well for about 5 to maybe 7 minutes or so of therapy, and then he's quite relaxed in this spot. So we'll come back after we've done this and let you see what his reaction is. This is current mid-therapy with the MR4 ACTIVet on the trigger point on River. As you can see, we've kept the laser in one single point at this juncture about 3 minutes in. And if you watch closely, you can see the muscle starting to quiver, much like it's being activated like a trigger point, even with dry needle therapy. So if you watch closely, you'll see the rippling effect that you'll see with the muscle. And eventually, by the time the therapy is done, what you see here, this rippling effect and kind of quivering the muscle will have gone away. So we just finished the psychotherapy for 5 minutes with River at this trigger point. And so if you saw earlier in the video how reactive he was and how much the muscle was quivering at the time, so now we'll come back through and press down as hard as we were last time in that spot, and you can see that the trigger point is no longer active and we don't have the muscle crawling and him trying to kind of walk away from us. So it's one trigger point and a multitude of different trigger points along his back, but it's just one classic example of how you can actually treat these trigger points without having to use dry needle therapy, and the horse will respond to it quite favorably.